Thank you, Kyle. I just thought colors was a box of crayons.
Now our next presenter will be talking what in the world is neuropsychology. Sarah, everybody.
Now, when I first got into this project, I didn't really know what I was going to do. I had no idea what I was really even supposed to be doing. I mean, I had to find a nonfiction book, one that I would enjoy, and do a dialectic notebook on it. And for those of you who don't know what a dialectic notebook is, well, you have a lot to look forward to because they're so much fun. And then I kind of decided to continue on with this. I read this book called The Man Who Mistook His Wife for a Hat and Other Neurological Tales, or Other Clinical Tales, I'm sorry, by Oliver Sacks. And it was very strange to me because I'd never really considered myself a science person. I prefer English and history. And then I really started to enjoy this book, but it was very in-depth and complicated. And I think my first taste of that was when I went to the doctor's office with my older brother. And I had this book in my lap. I hadn't really started reading it yet. And this nurse comes up to me and she goes, "Oh, you're reading this book, it's so good. Are you interested in neuropsychology?" And like any intelligent, public educated student, I very eloquently go, "Huh?" And I started to read this book and I got kind of confused and lost. And then I really started to enjoy it. And now I'm going to try to explain to you what neuropsychology is, and you can decide whether or not I'm actually just making this up. So, what is neurology? Neurology is the study of the brain. Psychology is the study of the human mind. And when you put these two together, you get something a little bit different. Neuropsychologists study patients with neurological disorders, and then they treat them on a psychological level, meaning they don't treat them like a well-oiled machine that just has a problem or a defect or a default and needs to be fixed. They treat them like a human being, and I think that that's one of the most important parts of medicine, is to keep in mind that you are treating a human. Now, first we have to talk about the function of the brain before we can get into anything very specific. The left hemisphere of the brain controls speech, whereas the right one assembles full pictures, recognizes patterns, many other things, including interpreting your emotions. There are, of course, many other functions of the brain, but these are the ones that we're mainly going to be talking about. Now, what's really strange and difficult to understand is that when you get an injury to your brain, the opposite side of your body is affected. So your football players, your war veterans, if they were to get hit on the right side of their brain, they might lose all feeling in the left side of their body. They might lose feeling in only one limb. They might feel an extra limb. They might lose the entire left field of their vision. And this is very weird and different, and it's just one of the many things that makes neurology in general a difficult field of study. So now we're going to talk about brain injuries, specifically traumatic brain injuries, which are almost completely impossible to get over. You can get therapy for them, but there's no real way to prevent them. Now, there's aphasia, which is when you are unable to communicate. You're unable to read, you're unable to write. Apraxia is very weird because it's caused by a difficulty in your brain in planning. So while I might understand that I want to move my hand around like this, somehow the command never gets written. Dysarthria is pretty much the same thing, except this command is written. However, it gets lost somewhere in between the writing of it and then the actual action. So I still am unable to move my hand. Ataxia causes a lack of coordination. There's also neurodegenerative diseases. Now, how many of you know someone with dementia? Raise your hand. Alzheimer's? Raise your hand. Okay. Well, dementia as an overarching category is anything that causes difficulty and impairs your ability to lead a normal lifestyle. So, normal is pretty relative, so what exactly does this mean? Well, it causes difficulty in communicating, it makes time seem funky and out of whack to you. It makes your decisions and your judgment area of your brain not really function the way that it should. And out of these dementias, there are a few different types that I'm going to go into. There's vascular dementia, which usually occurs after a stroke. It's when there's not enough blood getting to your brain, and therefore you can't really function properly. There's also frontotemporal dementia, which causes apathy and a social drawback. Oops, that's the wrong thing. And then there are inherited prion diseases, which are even more strange. Prion proteins fold in on themselves and they destroy your brain cells. Now this is completely incurable because we don't even know what prion proteins do. And that's very strange. The brain is a very strange place where you have a lot of these functions and you don't know what exactly they're meant for. So Creutzfeldt-Jakob syndrome is one of the most common of these. Fatal familial insomnia, well, if you've ever thought you're going to die from sleep, that's not really possible, but these patients suffer from insomnia so severe that they can't sleep, ever, and when they do, it's wracked by horrible nightmares. And what does this mean? Well, it means that the tissues in your brain are damaged and that you're going to die from it eventually. There's also Kuru disease, which you might have heard of. This occurred in Papua New Guinea, and it was caused by cannibalism. It's referred to often as mad human disease. Normally, cannibalism does cause a lot of issues, but eating the brain of a human is especially strange because it causes this disease, and we still don't really know why. Now, it would make people go crazy and insane, and they would start laughing to themselves uncontrollably, and were unable to stop. And the only real way that it managed to die out was when the government finally put down its foot and said, "Hey people, cannibalism is bad, let's not do it anymore." And of course, it still continues a little bit today, but it is dying out for the most part. So don't eat brains. I think that one of the most important parts of neuropsychology and medicine in general is to discuss the burden that is put on the family. Now, I think that it's the patient's choice, because a lot of the diseases that I have talked about are completely incurable. There is no medicine out to treat them, and the medicine that is out really only lessens them slightly in severity, or lessens the pain that you feel from having them. So, what should we research then? Should we put money into these usually very rare diseases and, research them, look for a cure? Should we do that? Well, right now, most of the research is privately funded. There's not a lot going on in terms of government research. And honestly, compared to the other leading causes of death, especially in America, these deaths are nothing. So should we even be trying to find a cure? I say yes. I say we focus on the most severe of these diseases. We focus on the one that kills the most people. And then we try and find a cure for that. But it's like cancer in the respect that the technology that we would need to cure it is so far out there that we wouldn't be able to even think about it for another 30 years or so. There is not going to be a placebo, a specific cure-all for every single disease out there, or a panacea. But in the end, it is the patient's choice as to whether or not they want to receive any sort of treatment for these diseases. And I think that that's the most important part of neuropsychology, is to understand the person that you're studying. Thank you.